بس management pulmonary embolism management معمولا IBC call for help depending on the clotic status. You might call for help from the hematology. Severe preeclampsia مساوية the airway and breathing likely to be secured, but seizures between the seizure need treatment. Here seizures are very short and short lasting and self-limited, but should move laterally and oxygen large bone cannula. Side effect قبل consideration delivery moms باید stabilize باشه، blood pressureش باید پایین باشه، fluid balance و IV MG مغنیزیم سولفایت یدینه. نشان داره که مغنیزیم سولفایت یک دیوم بیشتر کن کم کرده و ساید افکت کنی فقط فلاشینگ. اول با 4 گرم نسبتین دو دیکریز یکیم با 1 گرم لیک ساعته. نشان داره مغنیزیم سولفایت که blood pressureش رو هدا دگره و overdose that باعث pulmonary and heart depressive, but it is reversed by calcium gluconate. Blood pressure باید decrease بشه for safety 5%. ICP intracranial pressure برز به hemorrhage به خاطر poor blood pressure control و لصدو شست سیستولیکه که مخصوصا دادگین انتی هایپرتنشن درای و کلا بتولول یا با آیوی یا اورال ایدینه و اورال نیفیدیپین با آیوی و اورال نیفیدیپین و هلوها آیوی هیدرالازین. هر 5 به 15 دقیقه observation monitoringi بکنین بستگی به stage دایکه و gradually decrease the mom blood pressure to avoid fetal distress and bradycardia. Management problems fluid is very problematic چون intense peripheral vasoconstriction here ده که و هر decrease plasma level volume منظور منه urine output و input که زوان measurement دکین چون که اگر overdose به lung و brain odema توشه به یعنی the structure output و input control again need catheterization بخاطریو کارم و blood product کریستالیودی دینه خونریزی اگر نبه 8 میلی لسر hours به fluid decrease به یعنی هم به اورالی هم به IV فقط 8 میلی یا کمتر لی بسا. renal failure کنی ما temporary و دو اتاکی به تو دوی pregnancy که یاشته بود. Timing delivery depend on the gestation and complication and severity stability. حالش بعد stabilizeش کن deliverش کن. اگه delivery is likely کمتر لسی و 4 ویکشه استرویدی بده استروید دل حالی دیگهش تاکه گاتوا و help من علىکش تکه بوی لانگه کنی مطور بن. معمولا سیزارین انتخاب کن ولی واجنالش وقتی که completely clotting corrected بو هموش تکانی رکه ابیا. HELP syndrome يعني hemolysis برز بونوي liver enzyme low platelet لپیست بوده سرای severe preeclampsia کان توش انده به most common in the multiple لوانه disseminated IV coagulate به هیبه یعنی به or platelet abnormality fetal death placenta abruption or fetal death. Uterine causes of cases of emergency يعني uterine rupture or tear بخاطر previous injury of the uterus. It's very rare 0.03%. Mostly previously cesarean krawa يعني scar not have been inherent as myometrium. طبعا من عنده بقودنيا abdominal pain مساوية رجل scar tenderness often not masked epidural analgesia يعني بإبيدورال شو هرديشة vaginal bleeding هي وهيماتويوريا لواني هبلواني نبي if uterine rupture into the bladder هيتي و typically continue stops and declarate at stops and declarate and CTG if rupture late second stage من هي معلوم نابت يمكن ونرجعني هي معلوم نية و intra bleeding دوای كدر ما هنا منالك immediately منالك بخاطر CTG abnormal در هندراوة immediately postnatal internal bleeding circulatory collapse abdominal discomfort نشانية داكا uterus يدراوة management داكي ABC immediate laparotomy and during away uterus okay frequently frequently only safe treatment is hysterectomy uterine inversion rare complication during vaginal delivery يهردوكن third trimester يجلس 2000 إلى يجلس 6000 uterine fundus descend as a cervix cavity of the uterus you can see very rarely beyond the introitus. Diagnose prolapse uterus. Now cervix, strength from the cervix, vaginal stimulation, vagal stimulation, pulmonary cardiovascular collapse, shockitush budakeka. Hemorrhage common everywhere uterus in the introitus, lack of the palpable uterus in the abdomen, feeling deeply in uterine fundus in the abdominal examination. Management of the ABC, remove placenta if attached. Don't remove the placenta if attached to the bleeding. Immediate replace of the uterus through the cervix by manual compress. If failure, hydrostatic pressure by pouring the warm saline into the vagina mamulan by seal cup ventouse. Tocolytic may be helpful, reducing the ring, relaxing the ring of the cervix, and اگر هر نبو surgery to reposition after after بوي كبيرة إنه uterine contraction يعني oxytocin يدينا. Sudden mom's collapse as in non-pregnant. Some being benign vagal attack, epileptic fit, يعني simply faint, but some of them is life-threatening. Pulmonary embolism is most common. باعث مرگی دهی که به suddenly cardiopulmonary collapse. Diagnose management به urgent necessary resuscitation ABC. If PE suspect anticoagulation should be instituted. And embolism, amniotic fluid embolism is very risk of the mom collapse. Amniotic fluid reach the circulation of the moms, severe dissemination, intravenous coagulation. نبيندرتها معمولا can't be maybe abnormal mom's reaction to AF. Difficult to in life, but in postmortem it's very easy, of course. And we can find hair or squamous cell in the pulmonary capillaries. Diagnose and management ABC, before collapse. Symptoms before collapse may be helpful for diagnosis: breathlessness, chest pain, feeling cold, lightheadedness, restlessness, panic, and pins and needles in the fingers, nausea and vomiting. Poor prognosis: silsat and dembren, only tunnels than survivable. silsa فقط ساعة. Fetal emergency may affect the eye. May be affected by any mom's emergency, but some cases, emergency directly affect the fetus بيوكل major effect ببينين مثلا major heart rate abnormality, bradycardia, call for immediate delivery, C-section. Cord prolapse, any umbilical cord below the fetal when membrane is intact or ruptured. يجلسات pensary delivery كهنكات الزورة. When pushing part does not fit well into the mom's pelvis, giving space to the cord to prolapse. Diagnose: seeing cord in the introitus or feeling vaginal examination, abnormal heart rate of the fetus and deep declaration, compression of the umbilical vein lead to bradycardia. Then while more made to deliver, white plants made to deliver, move woman to AV all fours for head descending. Apply press vaginally. Apply pressure vaginally to push present part out of the pelvis and filling bladder by 500 ml of saline. May handling the cord لو أنا handling the cord مكة بخاطر compression باكيتو نالكا hypoxic if cording is behind the intuitus put it inside the vagina to keep it warm. من handling emergency بنربو emergency C-section مكة أو fully dilated vagina here vaginally is safe. Outcome depend on the complication IU grows restriction يعني the goal term of the baby termed baby باشا بلام prompt how long the cord has been compressed زور مهمة. If cord outside the hospital felt fit likely to be dead because of the time that has been comes there. Longer than 10 minutes cerebral damage if 20 minute is death. This time is shorter when the FGR or prematurity. Shoulder dystocia maneuver to release the shoulder after the gentle downward traction has been failed. 0.6 درصد result excess morbidity and risky fit hypoxia, death and trauma in the form of the fracture yani large bone under the arm, brachial plexus, clavicle or all. Form of increased risk of the bleeding, pain and trauma 3 degree 4 degree tear. None of the risk factors clinically useful for prediction. تقريبا لسردو in the normal weight of infant. يعني وانا بلا ينزور كورة. Rotate to make use wide with widest pelvic diameter. David Kelleke had rotate the shoulder in the anterior posterior diameter if shoulder not enter to the pelvic inlet. Anterior cut يعني دتواني anterior شانكيا بجرين لسرويس pubic symphysis. Diagnosis كما زورا سانا shoulder fail to descend turtle sign يعني during the test the next contraction delivery of the head appear to be pulled back on a perineum at the delivery. Management vary and harming. Management should be dural type training. Practice in dural type training. None more gentle traction apply on the fetal head. The vessels of the neck may be occluded by the delivery and cerebral damage if delivery is delayed. Depends the risk cerebral damage man here. Inappropriate traction خصوصا downward traction of the head leads to lateral flexion and stretch the brachial plexus and nerve damage. Herb palsy لو أنا رويبدا. أيما كمان أويك decrease the anterior posterior diameter of the shoulder and gain the maximum space of the mom's pelvis. Call for help. Assume the time of the delivery يكم which the shoulder is anterior يعني arm در خطرة and time maneuver employed. low time أو time ده drop the level of the bed as low as possible and flat the back of the bed. Assess the episiotomy if needed. Mac Robert maneuver دلتو دانا assistance أولا نخوشك ولكن نخوشك برزك no ties on the abdomen. هر لاقي بس كيو نسنن flattened lumbosacral spine كحالته facilitate the delivery نوتر. Suprapubic pressure by the another assistant. It pressures the anterior posterior aspect of the shoulder. Push shoulder in together. Used in constant and rocking motion. يعني constantly press rocking press. Internal maneuver depends on the skill. The maneuver man here boy internal rotation. Robini do woods reverse woods. يعني نسرعة منتنا جيشتم. If all the rotation attempt to rotate the baby, so should enter the diagonal to allow the delivery. If all of them are being failed, move the woman to all fours as it increases anterior posterior diameter of the inlet. In this position, posterior the arm can be delivered. last resort سیمپیزیۆتۆمی پێی دەڵێن زەڤانیل سیمپیزیسەکەی لەسەر پیۆبیکی ئەکاتەوە هێدەکە دەگەڕێنێتەوە بەو ژوورێ و دەیبا بۆ عملیات ینی intentional fracture کلاویکڵ و ئارمەکانی بۆ چاکەکاتەوە